supported or opposed the certain bill. Once it gets through one chamber using that process, and it goes to the other chamber and starts the say the legislature is like watching sausage be made. It very much is like that. Bills are introduced and picked up together again over and over again. So that's a little bit about how the process works. Obviously, once it passes chambers, it goes to the governor, who has the right to veto a bill if he so chooses to do that. Or he can let it sit and it becomes. Let's talk for a moment about committees of reference. That's where the bills go to. We call them committees of reference. There are, goodness, I don't know how many committees in each chamber. Probably it is public health. I can tell you we have 2 healthcare committees in the House. One is called Health Insurance and Environment, and the other is Public Health. And Public Health is a misleading name because when they refer to public health, they're talking about our entitlement program, Medicaid. So any bills, we will get public health cares, true in public health nature, go to public health as well, but that's not why the committee was named Public Health. In the Senate, we have the Health Human Services Committee, where all health bills go. Now, I need to preface this when I say all health care bills go to these committees. That indeed is not true. Assigning a, you remember when I said that the Democrats were in control of the House? That means that the leader of the House, the Speaker of the House, is a Democrat. And the Speaker determines what bills go where. So if the Democrats want a bill to die, and let's say it's a health care bill, and I'm going to pick on Senate Bill 3, which is essentially repeals the health benefit exchange in Colorado, the Democrats don't want that bill to pass. So in the House, I would imagine that they would send it to what we call the Kill Committee, which is called the State Veterans and Military Affairs Committee. That committee is a committee where bills go to die. Now, there's a caveat to that as well. There's a caveat to everything as you're guessing so far. And sometimes bills go to State Veterans and Military Affairs because that is indeed the true nature of the bill and needs to be heard there. But each chamber uses the State Veterans and Military Affairs Committee to send bills there to be killed as well. So each issue, if you will, typically has a reference committee where the bill goes to be heard unless they want it to die. And then the bill goes through a committee hearing. The committees range in size from 5 to 13. It's always an odd number, so there cannot be a tie, and the bill will either live or die. The majority gets to pick how many people sit on that committee, and each party gets to pick their own members to sit on that committee. So, for example, the Democrats get to choose which of their Democrats sit on which committees, and the Republicans get to choose which of the Republicans sit on those committees as well. As I said, each bill is required to have one committee hearing with public testimony. Let's talk a little bit about public testimony. Many people come to the Capitol to testify. We see citizens, but largely we see special interests, and CPHA is considered a special interest. The name is given a dirty meaning, but essentially all special interest means is there is a group, an organizing group behind an issue that works at the Capitol to advance legislation that promotes their issue or kills legislation that would harm their issue. So in our case, let's pick the Colorado Public Health Association. We have a policy committee, which we all encourage you to join, and CPHA will testify on bills on behalf of its members, you, on the bill itself. The purposes of the testimony is to explain your position, and when we usually have testimony from a special interest, i.e. CPHA, we like to provide an expert to do the testimony because you may get questions on the bill, and if you don't really understand the issue of the bill really well, it can be a little challenging. Now that said, you don't always need to be an expert either. The legislature smiles kindly upon testifiers, especially if you're not a lobbyist or a lawyer. If you're just an average person coming from your organization or off the street, they're always mostly very kind to you. Well, they will ask you questions and you answer accordingly. The purpose of the committee hearing and your testimony, though, is to explain how the bill will impact your organization or you personally. Sometimes you testify just to describe an amendment you want put on, or amendment that you know is being offered that you don't want to be put on. So sometimes people go up there and say, I'm neutral on the bill, but if you add this amendment, I have to oppose the bill, or if you add this amendment, I will support the bill. Oftentimes, too, public testimony and hearings will generate regular media or social media on an issue of the bill. So I'm going to pick on here for a moment anti-choice bills. There are a lot of those every year in the Capitol, and sometimes the media will cover those bills because they're always sexy for the media to cover. We have several issues outstanding every year at the Capitol of bills that are considered hot topics, and the media usually covers those as well. So who should testify? Frankly, anyone can testify. But for someone like CPHA, we're going to want to pick someone who might have some knowledge on a bill. So for example, if a bill is relating to healthy eating and active living, we want to rely on our members who work in that field, who can speak with ease about the issue and particularly what's addressed in the bill. Sometimes I'm thrown into the role of testifying, and that happens, and that's okay, but it's not ideal. We threw out some other ideas here, and this is based on our client base. You can have doctors, nurses, social workers, restaurant inspectors, anybody testify if they're knowledgeable about the issue. Some strategy is engaged here too. As your lobbyist, and this was a great example we'll use last year, and forgive me as I'm pulling up this bill from the dredges of my mind because it's been a year and I've learned a lot since then. But there was a bill last year that would have would have done a lot of damage to how local public health agencies can work with their local public health officials on creating any kind of local policy pertaining to the tobacco retail agencies. This bill would have made it hard for our local public health agencies to do that, and CPHA was very opposed to that bill. So when we drafted and crafted testimonies that can be a very strategic part of a bill, getting a bill to live or die, we looked at the legislators on the committee, and we tried to pick a constituent from each of that legislator's district to testify on that bill. And it worked in this committee because we had someone from Pueblo testify, and his legislator was undecided, and she opposed the bill because of his testimony. So their testimony can be incredibly powerful. On the flip side, testimony can be very moot because my job as a lobbyist is to count the votes on that committee before the hearing is ever even taking place. So if there's a bill that CPHA wants passed, I'm not going to wait till the day of the hearing to see whether or not it passes. I'm going to do my work ahead of time and reach out to every legislator on that committee and count the votes to make sure I have the number of votes to pass it. And if I don't, I need to get to work on trying to convince that legislator to pass the bill. So as a little more background on testimony here. So you want to establish and tell your story. That's why you're there. Stories are very powerful. You want to know your information. So if you have data and stories, you want to share it. And the rest is what we talked about, kind of scheduling and holding effective meetings, establishing and maintaining relationships, and do's and don'ts is what we're going into next. So let's talk a little bit about establish and tell your story. The two goals there is to inform and educate about your organization, agency, or yourself. You want to develop something to provide to them, and then you have the challenge here, which is something lobbyists have gotten really good at, is reducing it to what we call an elevator speech, something you can talk to somebody in an elevator with for that sometimes 45-second only ride, and get them to understand your issue, which can be incredibly hard. It's very hard to do, actually. But the more you do it, the better you get at at doing it. You want to inform and educate about the policy issue or change. So oftentimes bills are created based on anecdotal stories, and we all know that anecdotal stories can be harmful, especially to the world of public health. Let's pick immunizations, for example. There were a few debunked research papers showing that immunizations led to, why can't I think of the name? Immunizations, autism. I kept wanting to say Alzheimer's. I know it's not Alzheimer's, that it can lead to autism. And so it is our job as public health experts to lay out the facts that vaccinations do not lead to autism, but you need the science behind to show your point. And that's where this comes in handy. We already spoke about this, but essentially choosing the spokesperson you want to represent your organization at the Capitol and to make sure that spokesperson has done their homework. Let's talk a little bit about when you schedule an effective meeting and how to do that with the legislators, some do's and don'ts. We do want you to provide written material with more information, including your name and contact. We do want you to present, but allow enough time for questions and dialogue so that the legislator can ask questions and you guys have a great dialogue back and forth. We do want to make sure that you make the connection between your agency or your organization and yourself and others like you in the state. So, for example, mention CPHA and me as your lobbyist. All the legislators know who I am. And we want to make sure you have an ask. And I want to talk about this for a minute. So, the legislature meets, as I said, January through May. In the interim, what we call June through December, that's the best time to sit down with your legislator, say, hey, my name is Diana Protopapa. I'm a constituent. I just wanted to talk to you about some of the things that are important to me and I see what's happening in our district. Or, my name is Diana Protopapa. I'm a constituent. I work in public health. And I would like to talk to you on behalf of CPHA to talk to you about some of the issues we're looking at so that we can create a dialogue about this back and forth so that hopefully we can work together during the session. Excuse me while I grab some water. You don't want to have that courtesy meeting during session because the session is 120 days long and there are, on any one day, hundreds of people looking to talk to this legislator. And chances are those 100 people want to talk to that legislator on a bill that legislator will be voting on. So you want to save any communication you have with your legislator during session to be on a bill that they're looking at or a bill that's going to be impacting public health or your issue at hand that they're going to be voting on. And that's what we call an ask. So when you attend a meeting, you want to make sure you have an ask of them. And it's going to be something that they're facing at the legislature. A few don'ts. Don't hold a meeting with, like I like to say, a cast of 1,000, where you have 500 people like you meeting with one legislator. And when I say 500, I even mean really not more than 5. It gets to be too crowded and chaotic and confusing for the legislator. When you do have that meeting, pick a ringleader for that meeting. Don't plan on talking for more than about 15 minutes before giving him or her the chance to talk. Succinct and to the point is what legislators like. These legislators are lay citizens. They are not experts. Some of them aren't experts on anything they're seeing in the legislature. By and large, some have an issue here and there that they are an expert on, but you're going to be talking to teachers and ranchers and housewives and retired people that might have worked in telecom. So they're just normal, everyday people like you and I who chances are you will always know more about them on public health than they do, unless they come from our world. This last one says just don't talk at them or show a slideshow exclusively. A slideshow is good to show the data, but not like an orientation thing. You want to get to know your decision maker in advance of asking his or her help. So, for example, that's where the interim comes in. Hey, I'm Diana. I work in public health. I just wanted to meet you. You're my legislator. There's going to be some issues that we face this next coming session. I really want to be able to call on you. You do want to be on time for appointments. They hardly ever are, but that doesn't mean you shouldn't be. You want, as I said, you want to have one chief spokesperson. You want to keep the bottom line in mind, where we talked about the concise, clear comments. And this is very important. You want to be convinced in what you are saying, because if you aren't, they won't be. So this is where you need to build some fake bravado and confidence, even if you don't feel it. You want to show local examples. You can write emails, letters. We've covered a lot of this. Leave material for them. Here's something important that we haven't covered. If you do not know the answer to a question, do not lie. Your credibility is everything to you down there. Say, I don't have that answer. I will find it for you and get back to them. And you actually do have to get back to them. So remember, the number one goal for me, or mantra, or credo, or whatever you want to call it as a lobbyist, and for you, is never lie, because that legislator will remember, and our word is all we have to stand on down there. If you say you're going to follow up with them on something, follow up with them, and do write a thank you note. It's thoughtful of you, and it really impacts them to see that you share with them that you really appreciated the time you spent together. Along with don't lie, I meant like don't mislead either. Don't give false information. Do not send form letters. So that's something, if you receive an action alert from CPHA, you will note that we never give you, send this letter and put in data in the following spots, because they call that AstroTurf, and they do not read it. They ditch it. They see it's a form letter, and it was just a scam to get I shouldn't say a scam, but it's a way of an organization getting lots of their members to send in a letter. But they don't read it, because they feel like you haven't taken the time to let them know how it's directly impacting you. So we tend not to like to send out form letters. Do not use healthcare jargon or acronyms. If your mom doesn't know what CPHA stands for, and she likely doesn't, they're not going to know. You have to spell everything out. Remember, they're not healthcare experts. Do not, I repeat, do not argue with them. You might be stuck with the misfortune of having a legislator who is your legislator, who is very ideological in a way that is opposed to your ideology. Do not engage with them in a conversation that you know you are not going to win. Think of Facebook. Who wins an argument on Facebook? No one does. It's the same situation with this. You go there, you talk to them about what you want to talk to them about. If you're not talking about climate, don't talk about climate. If you're not talking about vaccines, do not talk about vaccines. Talk about that issue, recognizing that he or she may bring up another issue that has nothing to do with what you're talking about, and in this situation, I just sit there and smile and nod. I might disagree with them. I might be 180 degrees away from them on their thoughts. I just smile and nod along like I know what they're talking about. And what goes along with that is don't belittle don't belittle those who disagree with you. Don't talk ugly about your opponent. And especially with legislators, they might be with you on the next issue. That's when people say politics makes strange bedfellows. It really does. I have 25 clients, and one legislator might work with me really well on 4 of those clients and work really poorly with me on the other 21. I put it aside and work with the legislator that I have a good relationship with on that one issue for that one client. That's it for me. We're happy to entertain questions or answers. I'm going to turn it over to Amy.
Okay, well, thank you everyone for your attendance today. I hope this has educated you in how you might engage with your legislators, and I hope that you'll, to some extent, let us be your guide and your convening place for doing that, because we're going to try and facilitate some action on behalf of the association, and you all are the experts, though, in how this plays out in your communities, and you're the contact people for legislators around the state in your own districts, and that's a great strength and advantage to CPHA when we do decide to take action. So in terms of questions. I know that some have come in during the webinar, so I'm going to turn it over to Brian Turner, who's been tracking those questions, and have him present those to Diana. And then if we have time, I have a few myself, because I've learned a lot in the webinar, but I want to learn more. So Brian, please go ahead.
You bet. So first, just a heads up to everybody. The webinar today has been recorded, and we will make the slides available as well. And we're going to post those to the Colorado Public Health Association website so that current members can go in and access those. If you are not a current member, what a wonderful opportunity and reason to become a member, renew, or join for the first time. A lot of great information shared, and it will certainly be helpful to have those slides in this presentation as a reference as you move forward as a public health champion. One of the questions that we received, Diana, is just a quick question about the length of time and that it can take for a bill to get through the process. So specifically, how long is the time usually between second reading, third reading, the different votes, when something might be heard in committee, and advancing through the process?
Great question. So I'm going to give you an example. So typically, the legislature puts forth calendars every day that shows what each chamber is working on for the week to 2 weeks coming. One of the rules is that the legislature has to post a hearing of a bill 24 hours in advance, so that everybody, so if you want to know when it's coming, you've seen it 24 hours in advance. Let me rephrase that. So if it's going to be Wednesday at 1 p.m., they have to make sure they've announced it on Tuesday, by Tuesday at 1 p.m. So you might not see it 24 hours in advance, but it's been posted 24 hours in advance. It can take forever. So, but you keep in mind, so here's the deal, because each bill has to go through each chamber, and each bill has to go through a committee, second reading and third reading of each chamber before it does the same on the other side of on the other chamber. As a lobbyist, you work really hard to get that bill through in a efficient manner, but things get in the way all the time. So, for example, if it's a very controversial bill, the majority leader of the chamber and of each chamber, the majority leader, remember that the Democrats in charge of the House, the Republicans are in charge of the Senate, calendar when bills will be heard on second and third reading, and they also calendar when they'll be heard in committee. So typically, it can be 3 to 5 days between second and third reading in each chamber. Unless it's a controversial bill, then they'll put it aside to be heard on a certain day where they don't calendar a lot of other things. I'm going to give you an example. Last year, I was representing the surgical assistants and technologists who were up. Their body of laws that regulated them were up for reauthorization. The bill was heard in the second week of January in its first committee, in its first chamber, and it passed the second chamber on the second to last day of session. It took 4.5 months. That happens, and the bill became controversial. It was a ridiculously easy bill that was very controversial, and that happens a lot too. Every time you think a bill's going to be simple, think again, because there's no simple bill. There's no such thing. So it can take 4.5 months. It can take 6 weeks. It can take a month. Technically, all it needs is really maybe 2 weeks to pass, because you have to have 24 hours between second and third reading in each chamber before you can hear a bill. So for example, Senate Bill 8, I'm making this up. If it's heard in committee on Monday, if it's heard in, second reading on Monday, it can't be heard for third reading until Tuesday. You need 24 hours between second and third reading. So that's a long-winded answer to the short question, sorry.
I think you covered just about everything possible on that question, so that's wonderful. Another question, so can you, I'm not sure if it was actually linked in the presentation, but a helpful place for people to go to get the information about when things are posted, the General Assembly website, any other resources that you think are really useful?
The General Assembly website is incredibly useful, and I used to have it memorized, and then they switched it on me this year. It used to be, if you actually put in leg.state.co.us, it'll send you to the new website. Again, that's leg.state.co.us. That will send you straight to the new website. When we say leg, that's LEG. And on it, you'll have everything you ever wanted to know. It'll have the calendar for each chamber for the following week. It will have a place to go for you to look up bills. It will give you a lot of the information I just talked to you about for the last 30 minutes. It'll give you contact info for legislators, anything you ever wanted to know, and then some.
And we'll be sure to post that on the CPHA website as well, and that'll be accessible where we have the presentation posted. Another question that came in, so will frontline or CPHA policy staff help with writing testimony if someone has never done that before or wants to get engaged? What's the process for helping people become more comfortable with contacting and interacting with their legislators?
So typically what I do when I have a client who wants to testify, I will say, I'm going to put together the frame for you, and I'm going to create a form letter for you. I'm going to create how you approach the committee, how you introduce yourself, how you introduce CPHA, and what you say, and I'm going to give you places to plug in what the bill does and how you feel about it and what your data states. And I'm going to send that to you, and I'm going to ask you to fill that in, and I'm going to ask you to send it back to me so I can reread it and edit it and make sure you're right on target. So yes, I make sure you're very well prepared when you go to testify. I'll just never send you out there to the wolves unless you piss me off, and then all's fair. I'm kidding. It's my job to kind of prepare you, so no worries about that.
Excellent. And I just posted in, hopefully everybody can see a response, for the name of that website is leg.colorado.gov, and that's the State General Assembly website where you can go and find everything that Diana mentioned, including links to the Joint Budget Committee and all their relevant documents as well. Amy.
Okay, so I have a question. You mentioned that it's very difficult to meet with legislators during the session. In fact, you don't recommend it. But I'm thinking that there might be some workarounds for that, to meet with either their legislative staffer who's keeping track of information for them, or to participate in coalitions where people are gathering so that they can have an impact during the session. Could you talk about those alternatives to individual testimony or individual meetings and how those might have an effective impact during the legislative session?
Yes, so if I said that, I didn't mean it in that way. What I mean is, during session, it's not the time to say, hey, I'm Diana, how are you, and this is what I care about. But if you say, hey, Senator, I'm really opposed to Senate Bill 3, and I'm your constituent, and let me tell you why, that's when you get in to see your legislator, when you have an ask for them. You don't use that time during session just to meet and greet with them. If you have an ask on a bill, by all rights, please sit down with them. I will help you schedule a meeting. But make sure you have an ask with it, not just like, well, now's the time I want to introduce myself to you, because they're going to be, they're busy. They're not going to have time for just a meet and greet during session.
And the value of connecting with a legislative aide in lieu of the elected official themselves.
A lot of them have legislative aides that they don't have the same weight and power that they do in D.C. The legislative aides in D.C. have a lot of knowledge behind them and influence with their legislators. The aides here largely are schedulers for their legislators or helping them set up meetings and the like. So honestly, when you go talk to a legislative aide, sometimes they look at you like a deer caught in headlights, because they're more afraid of you than you are of them. They don't hold the same power. You can try, but it's not the same.
As far as participating in coalitions, you, Diana, keep us apprised at the Colorado Public Health Association when there are those opportunities? Yes.
Oftentimes there will be a coalition working on a bill, and then you can engage in that way as well.
And also you mentioned about the 2-minute testimony. Mm-hmm. So for people who might be thinking that they would like to testify sometime during the session, is that a time limit that's generally imposed by the legislature, by the committee, by the chair? In fact, if they're thinking about testifying and preparing testimony, might they think it's a little bit less daunting because, in fact, 2 minutes is the time that they'll have to speak?
Yeah, we like to say 2 minutes because that's the most amount of time you usually get. And when I say you usually get, some legislators literally pull out a timer and start the timer for 2 minutes. That happens on big controversial bills where there could be 50 people waiting to testify. We ask you, though, it's our own rule to say don't make it more than 2 minutes. You'll lose their attention even if you try.
You mentioned that Frontline helps connect CPHA and its members to coalitions on different bills or policy initiatives that are advancing. Do legislators proactively reach out to CPHA and the public health community for input, analysis, testimony, etc.?
They can. The more well-known your organization is, the more likely a legislator will reach out to you. And when I say well-known, I mean more than just knowing the name. Well-known means how much money you give to legislators, how relevant you are in the stakeholder world, those kinds of things. So, for example, I used to lobby for the Colorado Medical Society, which is the state organization representing physicians. All the legislators wanted to know where the physicians were for several reasons. They gave money, and when you look at consumer polls, physicians poll really high as a voice of trust. Same with nurses, same with pharmacists.
In lieu of the large contribution approach, which is not an approach that's taken by Colorado Public Health Association, we're a volunteer association, and we don't have a lobbying war chest of funds for contributions and that sort of thing. Can we, do you think, be just as effective if we have a large number of people contacting their legislators who are their constituents or who are going in to testify on a bill? Could you comment on other approaches than contributions?
Yes. If you get 100 people to call one legislator, that's just as good as money. If Brian Turner, as president of CPHA, reaches out to his legislator, whoever that may be, and gets to know him really well, that legislator is going to call Brian and say, hey, there's this public health bill up. What's this about? Tell me, Brian. I know you work in public health. Or actually, Brian, you work in mental health. Tell me, is this bill good? Those personal relationships, all politics is local, is euphemism because it's true. The better you get to know your legislator, the more likely they're going to turn to you because you're going to be a voice of trust for them.
Brian, are there any more questions that we've received over our web link?
We are all done on questions.
Okay. Well, I just want to follow up again to encourage everyone that if you are interested in participating with us in policy on behalf of the Colorado Public Health Association this year, please do email phApolicy16@gmail.com and ask to be added to the policy committee. And this week we do have 2 upcoming events. First, we have our regular monthly call on the first Thursday of the month on February 2nd from 12 noon to 1 p.m. If you email and say that you'd like to be added to that committee, we will forward you the information for that call and how to join the call. And then we also will have our early session legislation review in person at the Colorado School of Public Health on the evening of Thursday, February 2nd, from 5:30 to 7:30 p.m. And members of the committee, students, others interested are invited to join us for that event as well. Again, if you email, we can provide you with the specific information, or you can also go on the website for the Colorado Public Health Association or check the last newsletter that you received as a CPHA member, and there will be registration links in that email, and we would appreciate it if you could please register for that event because some refreshments will be provided and we want to make sure to have enough for everyone. Thank you again for joining today's call. I'm going to turn the floor back over to Brian Turner, CPHA's president, so that he can comment further about upcoming events.
Thanks, Amy, and thanks again, everybody, for joining today. Thank you to Diana for the excellent presentation. A reminder to check out CPHA's website to access resources regarding public health policy, but also for updates and information on all things Colorado Public Health Association. We have lots of great events going on all year long. We have a large Culture of Data conference focused on health equity coming up late spring, early summer, and then, of course, Public Health in the Rockies in partnership with a lot of our other great partners in public health and the public health community statewide happens next fall. So plenty of opportunities for your involvement. Go there to the website to get all the information you can need, and please don't hesitate to reach out to us through the CPHA policy website or myself directly if you have any questions about the association and how you can get involved. Thanks again for participating. Really appreciate it, and hope you have a wonderful afternoon.